We're here with Mr. Foust of Metro Wellness Health. Do you want to tell us a little about yourself and what your organization does?
Sure. So my name is Cole Foust. I use he, him, his pronouns. I'm the LGBTQ plus program manager here at Metro Inclusive Health. We actually started in 1993 out of a church. There were some folks that recognized that people living with HIV and AIDS had less access to care than those who were not. And so we started as an HIV and AIDS service agency, just with a couple people that cared, and we've grown exponentially since then. So we now have locations in Tampa, Clearwater, Newport Richey, and St. Petersburg. We do way more than HIV services. We also do inclusive primary health care, counseling services, HIV prevention and outreach. Through our partnership with CAN Community Health, we can offer HIV medical care, and then we do community programming, which is what I oversee.
So how do you personally view public health in our local community?
Public health is something that we all have to work together to educate and provide resources for. So to me, it's a matter of making sure that all of the community leaders are taking responsibility for the health and welfare of everyone that lives in the Tampa Bay area. We do have a lot of really great organizations, nonprofit, social services agencies that are looking to make sure that everyone has equitable access to care, but it's definitely a community effort.
So what importance does awareness of local public health issues have?
Having awareness helps in a lot of ways. So not only does awareness make sure that everyone has education and awareness to make sure that they're keeping themselves safe, it can also lead to making sure that we're putting funding for research towards certain issues in public health. And through research findings, we can then funnel resources to make sure that we have programs in place that can educate people and healthcare centers that can reach populations that might not otherwise have access to care.
What have you seen as public health issues affecting specifically LGBTQ individuals?
One thing that's really unfortunate is that a lot of the health education and public health awareness initiatives don't account for LGBTQ plus people. The language that's used is very gendered in ways that is not inclusive of transgender people, gender nonconforming people, and anyone whose sexual orientation is not straight or heterosexual. So we see a lot of assumptions made in the information that's released that somebody would be heterosexual, and so there's a lot of information and research left out of the conversation, and that creates issues with people contracting STIs and HIV because they weren't given the language as their heterosexual or cisgender peers were.
So how have these issues negatively affected our community, and how does spreading awareness change that?
They've negatively affected our community because there's a disparity there. People that are LGBTQ plus are not getting fair access to the same information and the same resources. And so moving away from making sure people aren't experiencing unjust experiences with regards to health, we again have to take responsibility as a community to make sure that we're all being more inclusive, that we're following best practices. Metro Inclusive Health offers inclusivity and awareness trainings to the community. So anybody that's interested in training their staff and getting their healthcare providers on board with best practices has that as a resource.
So what can you recommend for LGBTQ individuals and our community in general to better public health?
LGBTQ plus people, anyone that's in a position of leadership, I would strongly encourage them to try to advocate for change, to make sure that if they're in public health settings that the language is representative of all people, including those sexual and gender minorities. Making sure that they're questioning, let's say if they go to their doctor's office and they notice that the intake forms don't have an option for somebody to mark that they're a transmasculine person or a transfeminine person, that they do local work to make sure those forms do become inclusive. Because if it can start with one person, one small change, that can be the model for the rest of the community to make sure that there aren't so many disparities.
Do you have any last regards or comments regarding public health, LGBTQ individuals, or even Metro Wellness Health?
Just that public health really is something we should all care about, regardless of our personal interests and our careers. We all have to be invested in public health because it starts with us, and we can really make a difference in our community across the nation when we start to take accountability for the community around us.
So with that being said, again, that is Mr. Cole Foust, the LGBTQ plus program manager here at Metro Health, and that concludes our interview.